Hi, it's Dr. Matt Harkness. Thank you for watching this video today. Well, I am excited to talk to you about TMJ, temporomandibular joint pain or disorder. Sometimes it's called temporomandibular dysfunction. So, what is this big word? And simply stated, I would call it pain in your jaw here, and it affects your function. So you may have difficulty opening. You should be able to open 3 fingers, and that's a good self-check. So maybe you can only do 2 or even 1. That's definitely a sign of restriction in that jaw. It's going to inhibit your function, eating, kissing, lots of different things if you can't open your mouth properly. Another thing you might have is pain actually in your ear. You might think it's a problem in your ear, but it's actually your jaw. We get a lot of patients from ENT, ear, nose, and throat specialists who go there for ear pain, and then they say, nope, it's your jaw. You need to see a specialty physical therapist who treats the jaw. Also, you could have facial pain. Sometimes you'll have even tooth pain. Your dentist has said you're fine, you don't have any cavities or any pathology with your teeth, but you still have pain in your tooth. That can be referring from the muscles down into the teeth, so we can help that. You can have headaches. If you have headaches, severe headaches at the back of your head, above your eye, even around your jaw and ear. Also, you could have, in rare cases, some swelling in the face. You might have more puffiness on one side. That could also be an indication that you have some fluid in the joint, just like if you hurt your knee and your knee swells up, it can also happen in the jaw here as well. At times, you can also have locking of jaw, where all of a sudden you have this acute tightness and you can't open your mouth, and that would also be an appropriate thing to come and see us here for. So lots of things that we can do to help you, and again, I always, like you, prefer not to have surgery. Don't want to rely on medication, but we are a very good source to get these things resolved. So you ask, well, okay, I do have pain in that area, but what is the temporomandibular joint? So let's take a look. So here is the skull, right? And we have here the jaw, which is you open and close your mouth. There. And right here, this is called the mandible. And this bone comes up and attaches right at the base of the skull, just in front of the ear. And that is a joint right there. You can see here I'm moving it, and that can become irritated. So that is a temporomandibular joint right there. Of course, just like any joint, say your shoulder, it's not. There's always, if the neck is irritated or even the hip, it will impact the joint. It's the same with the TMJ, that if you have stiffness in your neck, you have limited motion in the cervical spine, up high, down low, or even at your hips, it can kind of travel and create pain at the TMJ joint. So, how can a physical therapist help? Well, one thing, you want to search for someone that is specialty trained in the treatment of the TMJ joint. And this is a specialized area, just like my wife. She is a pelvic health specialist, and she has had lots of training, and that's all she sees. Same with me. I have a certification in cranio-facial physical therapy. I also teach with Michael Karaginas, and that's all I see is cranio-facial, TMJ, neck patients. So how can we help? So I think the first thing that we can do is we can listen to your story and validate that, yes, you have TMJ or TMD, temporomandibular joint disorder, and this is something that we see commonly, and we can lay out a clear path for how we're going to get you better. And most of the time when you come to see me, you have been to several different specialists, and it is very frustrating, and people, they don't seem to adequately answer your questions and provide a path to getting better. Well, I can do that. A good cranio-facial therapist can absolutely do that. So specifically, what we do is we do an assessment of your motion. We want to restore your motion, so we show you specific exercises to improve the motion of your jaw. We also look at the muscles in terms of the tension in the muscles, and we do techniques to manipulate them or use our hands to stretch out the muscles in the jaw, and then teach you how to stretch them as well. Remember, tight muscles restrict motion to any joint, so same with the jaw. Also, we teach you the best exercises in terms of how do you make sure that you are in the proper posture to open your jaw and use your jaw optimally. And so we give you the very best exercises, and we also take what we call a habit-based approach. So it's like brushing your teeth. Good jaw health, good neck health, good body health. It is a journey that you have to do simple habits, simple exercises consistently, and then you will maintain optimal function. Also, let's see, we can, education and prevention of how to be aware of, activities that may irritate that joint and how to avoid them. And even when you do have irritation, what can you do on your own, say, before you need to come and see a professional? Okay, so you've listened to the video and you think, oh man, I think I have this. And so the next step is to come and see us. First of all, you can simply go to our website, alliedpt.com, and you can click on the website, schedule an appointment, and we will get your insurance information. We do take all sorts of insurances. Some people, yes, we have a cash program, so some people use cash, which is money well spent as well, to get you functioning well. Talk to your dentist too, and your dentist, he's a good source to determine, yep, you definitely have pain at that joint and you need to see a specialty craniofacial physical therapist, and he can make a recommendation and refer you to us. And also you can simply look in your area. Sometimes craniofacial physical therapists are a little bit harder to find, so do a Google search, craniofacial physical therapy, and check the reviews out, of course, and make a call and come in and see us to help you. Also, be sure to look at our website. Again, we have a book here, Head, Neck, and Jaw Pain. It's got lots of great information in there. Take a look at that. And visit our YouTube page. We also have a lot of videos and helpful information there as well. And we look forward to getting you back to what you love, and making sure that you can enjoy the foods that you love, enjoy intimacy with your loved ones, and not have headaches when you're doing things in your everyday life. So look forward to seeing you. We've got a great team here of expert TMJ physical therapists.